Hay fever, Cetirizine hydrochloride pill, 10 mg. Hay fever is a type of inflammation in the nose which occurs when the immune system overreacts to allergens in the air. Drug.
Zyrtec Tablets 10 mg 1. Name of the medicinal product Zyrtec Tablets 10 mg 2. Qualitative and quantitative composition. Each film-coated tablet contains 10 mg of cetirizine hydrochloride. Excipients: microcrystalline cellulose, lactose monohydrate, colloidal anhydrous silica, magnesium stearate, hydroxypropylmethylcellulose, titanium dioxide, microgyl 403. Pharmaceutical form: white, oblong, film-coated tablet, with a bisect line and YY logo. 4. Clinical particulars 4.1 Therapeutic indications. Zyrtec tablets 10 mg are indicated in adults and pediatric patients 6 years and above, for the relief of nasal and ocular symptoms of seasonal and perennial allergic rhinitis, for the relief of symptoms of chronic idiopathic urticaria. 4.2 Posology and method of administration. Posology: 10 mg once daily, 1 tablet. Special population: older people. Data do not suggest that the dose needs to be reduced in elderly subjects provided that the renal function is normal. Patients with moderate to severe renal impairment. There are no data to document the efficacy-safety ratio in patients with renal impairment. Since cetirizine is mainly excreted via renal route, in cases no alternative treatment can be used, the dosing intervals must be individualized according to renal function. Refer to following table and adjust the dose as indicated. To use this dosing table, an estimate of the patient's creatinine clearance (CI/mL/min) is needed. The CL/mL/min may be estimated from serum creatinine MGD determination using the following formula: CL equals 140 age, years, x weight, kg, 72x serum creatinine MGDL, x 0.85 in women. Dosing adjustments for adult patients with impaired renal function. Group creatinine clearance mL/min. Dosage and frequency: normal equals 80 10 mg once daily, mild 50 79 10 mg once daily, moderate 30 49 5 mg once daily, severe 35 mg once every 2 days. End stage renal disease. Patients undergoing dialysis less than 10. Contraindicated patients with hepatic impairment. No dose adjustment is needed in patients with solely hepatic impairment. In patients with hepatic impairment and renal impairment, adjustment of the dose is recommended. See patients with moderate to severe renal impairment above. Pediatric population. The tablet formulation should not be used in children under 6 years of age as it does not allow the necessary dose adjustments. Children age 6 to 12 years. 5 mg twice daily, a half tablet twice daily. Adolescents above 12 years 10 mg once daily, 1 tablet. In pediatric patients suffering from renal impairment, the dose will have to be adjusted on an individual basis taking into account the renal clearance, age and body weight of the patient. Method of administration: the tablets need to be swallowed with a glass of liquid. 4.3 Contraindications. Cetirizine is contraindicated in hypersensitivity to the active substance, to any of the excipients listed in Section 2, to hydroxyzine or to any piperazine derivatives. Patients with severe renal impairment with a creatinine clearance below 10 mL/min. 4.4 Special warnings and precautions for use: alcohol. At therapeutic doses, no clinically significant interactions have been demonstrated with alcohol. For a blood alcohol level of 0.5 gl,
Nevertheless, precaution is recommended if alcohol is taken concomitantly. Increased risk of urinary retention. Caution should be taken in patients with predisposition factors of urinary retention, e.g. spinal cord lesion, prostatic hyperplasia, as cetirizine may increase the risk of urinary retention. Patients at risk of convulsions. Caution is recommended in epileptic patients and patients at risk of convulsions. Allergy skin tests. Response to allergy skin tests are inhibited by antihistamines, and a washout period of 3 days is required before performing them. Excipients. Patients with rare hereditary problems of galactose intolerance, the lactase deficiency, or glucose-galactose malabsorption should not take cetirizine film-coated tablets. Skin reactions. Pruritus and or urticaria may occur when cetirizine is stopped, even if those symptoms were not present before treatment initiation. In some cases, the symptoms may be intense and may require treatment to be restarted. The symptoms should resolve when the treatment is restarted. Pediatric population. The use of the film-coated tablet formulation is not recommended in children aged less than 6 years, since this formulation does not allow for appropriate dose adaptation. It is recommended to use Zyrtec oral solution. 4.5 Interaction with other medicinal products and other forms of interaction. Due to the pharmacokinetic, pharmacodynamic intolerance profile of cetirizine, no interactions are expected with this antihistamine. Neither pharmacodynamic nor significant pharmacokinetic interaction was reported in drug-drug interactions studies performed, notably with pseudoephedrine or theophylline, 400 mg day. The extent of absorption of cetirizine is not reduced with food, although the rate of absorption is decreased. In sensitive patients, the concurrent use of alcohol or other CNS depressants may cause additional reductions in alertness and impairment of performance, although cetirizine does not potentiate the effect of alcohol. 0.5 gl blood levels. See section 4.4, 4.6 Fertility, pregnancy and lactation. Fertility. Limited data is available on human fertility, but no safety concern has been identified. Animal data show no safety concern for human reproduction. Pregnancy. For cetirizine, prospectively collected data on pregnancy outcomes do not suggest potential for maternal or fetal embryonic toxicity above background rates. Animal studies do not indicate direct or indirect harmful effects with respect to pregnancy, embryonal fetal development, parturition, or postnatal development. Caution should be exercised when prescribing to pregnant women lactation. Cetirizine is excreted in human milk at concentrations representing 25% to 90% of those measured in plasma, depending on sampling time after administration. Therefore, caution should be exercised when prescribing cetirizine to lactating women. 4.7 Effects on ability to drive and use machines. Objective measurements of driving ability, sleep latency, and assembly line performance have not demonstrated any clinically relevant effects at the recommended dose of 10 mg. However, patients who experience somnolence should refrain from driving, engaging in potentially hazardous activities, or operating machinery. They should not exceed the recommended dose and should take the response to the medicinal product into account. 4.8 Undesirable effects. Clinical studies. Overview. Clinical studies have shown that cetirizine at the recommended dosage has minor undesirable effects on the CNS, including somnolence, fatigue, dizziness, and headache. In some cases, paradoxical CNS stimulation has been reported. Although cetirizine is a selective antagonist of peripheral high receptors and is relatively free of anticholinergic activity, isolated cases of micturition difficulty, eye accommodation disorders, and dry mouth have been reported. Instances of abnormal hepatic function with elevated hepatic enzymes accompanied by elevated bilirubin have been reported. Mostly this resolves upon discontinuation of the treatment with cetirizine hydrochloride. Listing of ADR's double-blind controlled clinical trials comparing cetirizine to placebo or other antihistamines at the recommended dosage, 10 mg daily for cetirizine, of which quantified safety data are available, included more than 3,200 subjects exposed to cetirizine. From this pooling, the following adverse reactions were reported for cetirizine 10 mg in the placebo-controlled trials at rates of 1.0% or greater. Adverse reactions. WHO ART, cetirizine 10 mg, N equals 3,260, placebo, N equals 3,061.
General disorders and administration site conditions: fatigue 1.63%, 0.95%, nervous system disorders, dizziness 1.10%, 0.98%, headache 7.42%, 8.07%, gastrointestinal disorders, abdominal pain 0.98%, 1.08%, dry mouth 2.09%, 0.82%, nausea 1.07%, 1.14%. Psychiatric disorders, somnolence 9.63%, 5.00%, respiratory, thoracic and mediastinal disorders, pharyngitis 1.29%, 1.34%. Although statistically more common than under placebo, somnolence was mild to moderate in the majority of cases. Objective tests, as demonstrated by other studies, have demonstrated that usual daily activities are unaffected at the recommended daily dose in healthy young volunteers. Pediatric population adverse reactions at rates of 1% or greater in children aged from 6 months to 12 years, included in placebo-controlled clinical trials, are adverse reactions, WHO ART, Cetirizine, N equals 1656, placebo, N equals 1294, gastrointestinal disorders, diarrhea 1.0%, 0.6%, psychiatric disorders, somnolence 1.8%, 1.4%, respiratory, thoracic and mediastinal disorders, rhinitis 1.4%, 1.1%, general disorders and administration site conditions, fatigue 1.0%, 0.3%, post-marketing experience. In addition to the adverse reactions reported during clinical studies and listed above, the following undesirable effects have been reported in post-marketing experience. Undesirable effects are described according to Madras System Organ Class and by estimated frequency based on post-marketing experience. Frequencies are defined as follows: very common, equals 1/10, common, equals 1/102, 1/10, uncommon, equals 1, 1000, 2, 1/100, rare, equals 1, 10000, 2, 1, 1000, very rare, 1, 10000, not known, cannot be estimated from the available data. Blood and lymphatic disorders, very rare. Thrombocytopenia, immune system disorders, rare. Hypersensitivity, very rare. Anaphylactic shock, metabolism and nutrition disorders, not known. Increased appetite, psychiatric disorders, uncommon. Agitation, rare. Aggression, confusion, depression, hallucination, insomnia, very rare. Tics, not known. Suicidal ideation, nervous system disorders, uncommon. Paresthesia, rare. Convulsions, very rare. Dysgeusia, dyskinesia, dystonia, syncope, tremor, not known. Amnesia, memory impairment, eye disorders, very rare. Accommodation disorder, blurred vision, ocular duration, ear and labyrinth disorders, not known. Vertigo, cardiac disorders, rare. Tachycardia, gastrointestinal disorders, uncommon. Diarrhea, hepatobiliary disorders, rare. Hepatic function abnormal, increased transaminases, alkaline phosphatase, YGT and bilirubin, skin and subcutaneous tissue disorders, uncommon. Pruritus, rash, rare. Urticaria, very rare. Angioneurotic edema, fixed drug eruption, renal and urinary disorders, very rare. Dysuria, enuresis, not known. Urinary retention. See Section 4.4, General Disorders and Administration Site Conditions, uncommon. Asthenia, malaise, rare. Edema, investigations, rare. Weight increase, description of selected adverse reactions after discontinuation of cetirizine, pruritus, intense itching, and/or urticaria have been reported. See Section 4.4, 4.9, overdose. Symptoms. Symptoms observed after an overdose of cetirizine are mainly associated with CNS effects or with effects that could suggest an anticholinergic effect. Adverse events reported after an intake of at least 5 times the recommended daily dose are confusion, diarrhea, dizziness, fatigue, headache, malaise, mydriasis, pruritus, restlessness, sedation, somnolence, stupor, tachycardia, tremor, and urinary retention. Management. There is no known specific antidote to cetirizine.
Should overdose occur, symptomatic or supportive treatment is recommended. Cetirizine is not effectively removed by hemodialysis. Management should be as clinically indicated. 5. Storage conditions and expiry dates. See outer packaging for storage and expiry date. Version number, HK052017, NCDS 04/EMC 20160712. Trademarks are owned by or licensed to the GSK Group of Companies. Copyright signed, 2017 GSK Group of Companies or its licensor. Zyrtec Tablets 10 mg. Patient information leaflet 1. What Zyrtec is and what it is used for. Cetirizine hydrochloride is the active ingredient of Zyrtec Tablets 10 mg. It is an antiallergic medication. In adults and children aged 6 years and above, Zyrtec Tablets 10 mg are indicated for the relief of nasal and ocular symptoms of seasonal and perennial allergic rhinitis, for the relief of urticaria. 2. What you need to know before you take Zyrtec. Do not take Zyrtec if you have a severe kidney disease, severe renal failure with creatinine clearance below 10 ml/min, if you are allergic to cetirizine hydrochloride, to any of the other ingredients listed in Section 6, to hydroxyzine or to piperazine derivatives, closely related active ingredients of other medicines. Warnings and precautions. If you are a patient with renal insufficiency, please ask your doctor for advice. If necessary, you will take a lower dose. The new dose will be determined by your doctor. If you have problems passing urine, like spinal cord problems or prostate or bladder problems, please ask your doctor for advice. If you are an epileptic patient or a patient at risk of convulsions, you should ask your doctor for advice. No clinically significant interactions have been observed between alcohol, at the blood level of 0.5 gl corresponding to 1 glass of wine, and cetirizine used at the recommended doses. However, there are no data available on the safety when higher doses of cetirizine and alcohol are taken together. Therefore, as it is the case with all antihistamines, it is recommended to avoid taking Zyrtec with alcohol. If you are scheduled for allergy testing, ask your doctor if you should stop taking Zyrtec for several days before testing. This medicine may affect your allergy test results. Children, do not give this medicine to children below the age of 6 years because the tablet formulation does not allow the necessary dose adjustments. Other medicines and Zyrtec. Tell your doctor or pharmacist if you are taking, have recently taken or might take any other medicines. Zyrtec tablets with food and drink. Food does not affect absorption of Zyrtec tablets 10 mg. Pregnancy and breastfeeding. If you are pregnant or breastfeeding, think you may be pregnant or are planning to have a baby, ask your doctor for advice before taking this medicine. Zyrtec should be avoided in pregnant women. Accidental use of the drug by a pregnant woman should not produce any harmful effects on the fetus. Nevertheless, the medicine should only be administered if necessary and after medical advice. Cetirizine passes into breast milk. Therefore, you should not take Zyrtec during breastfeeding unless you have contacted a doctor. Driving and using machines. Clinical studies have produced no evidence of impaired attention, alertness and driving capabilities after taking Zyrtec at the recommended dose. You should closely observe your response to the drug after you have taken Zyrtec. If you are intending to drive, engage in potentially hazardous activities or operate machinery, you should not exceed the recommended dose. 3. How to take Zyrtec tablets 10 mg. Always take this medicine exactly as described in this leaflet or as your doctor or pharmacist has told you. Check with your doctor or pharmacist if you are not sure. The tablets need to be swallowed with a glass of liquid. The tablet can be divided into 2 equal doses. Adults and adolescents above 12 years old, the recommended dose is 10 mg, 1 tablet, once daily. Use in children between 6 and 12 years old, the recommended dose is 5 mg, half tablet, twice daily. Patients with renal impairment. Patients with moderate renal impairment are recommended to take 5 mg once daily. If you suffer from severe kidney disease, please contact your doctor or pharmacist who may adjust the dose accordingly. If your child suffers from kidney disease, please contact your doctor or pharmacist who may adjust the dose according to your child's needs. If you feel that the effect of Zyrtec is too weak or too strong, please consult your doctor. Duration of treatment. The duration of treatment depends on the type, duration and course of your complaints. please ask your doctor or pharmacist for advice. If you take more Zyrtec tablets than you should, if you think you have taken an overdose of Zyrtec tablets, please inform your doctor. Your doctor will then decide what measures, if any, should be taken. After an overdose, the side effects described below may occur with increased intensity. Adverse effects such as confusion, diarrhea, dizziness, tiredness, headache, ailing, dilating of pupil, itching, restlessness, sedation, somnolence, stupor, abnormal rapid heart rate, tremors and urinary retention have been reported. If you forget to take Zyrtec tablets 10 mg, do not take a double dose to make up for a forgotten dose. If you stop taking Zyrtec tablets 10 mg rarely, pruritus, intense itching, and/or urticaria may be developed if you stop taking Zyrtec tablets 10 mg. If you have any further questions on the use of this medicine, ask your doctor or pharmacist. 4. Possible side effects. Like all medicines, this medicine can cause side effects, although not everybody gets them. The following side effects are rare or very rare, but you must stop taking the medicine and speak to your doctor straight away if you notice them. Allergic reactions, including severe reactions and angioedema. Serious allergic reaction which causes swelling of the face or throat. These reactions may start soon after you first take the medicine, or it might start later. Common side effects may affect up to 1 in 10 patients: somnolence, sleepiness, dizziness, headache, pharyngitis, rhinitis in children, diarrhea in children, nausea, dry mouth, fatigue. Uncommon side effects may affect up to 1 in 100 patients: agitation, paresthesia, abnormal feelings of the skin, abdominal pain, pruritus, itchy skin, rash, asthenia, extreme fatigue, malaise. Rare side effects may affect up to 1 in 1,000 patients: allergic reactions, some are severe, very rare, depression, hallucination, aggression, confusion, insomnia, convulsions, tachycardia, heart beating too fast, liver function abnormal, urticaria, hives, edema, swelling, weight increased. Very rare side effects may affect up to 1 in 10,000 patients: thrombocytopenia, low levels of blood platelets, tics, habit spasm, syncope, dyskinesia, involuntary movements, dystonia, abnormal prolonged muscular contractions, tremor, dysgeusia, altered taste, blurred vision, accommodation disorder, difficulty focusing, ocular duration, eyes having uncontrolled circular movements, angioedema, serious allergic reaction which causes swelling of the face or throat, fixed drug eruption, abnormal elimination of urine, bedwetting, pain and/or difficulty passing water. Side effects with frequency not known. Frequency cannot be estimated from the available data: increased appetite, amnesia, memory impairment, vertigo, sensation of rotation or movement, urinary retention, inability to completely empty the urinary bladder, pruritus, intense itching, and/or urticaria upon discontinuation. In very rare cases, people have thought about committing suicide, and if you feel this way, then stop taking the tablets and see your doctor. Reporting of side effects. If you get any side effects, talk to your doctor or pharmacist. This includes any possible side effects not listed in this leaflet. 5. How to store Zyrtec tablets 10 mg. Keep this medicine out of the sight and reach of children. Do not use this medicine after the expiry date which is stated on the box and blister. Also see outer packaging for storage condition. 6. Contents of the pack and other information. What Zyrtec tablets 10 mg contains the active substances cetirizine hydrochloride. One film-coated tablet contains 10 mg cetirizine hydrochloride. The other ingredients are microcrystalline cellulose, lactose monohydrate, colloidal anhydrous silica, magnesium stearate, hydroxypropylmethylcellulose, titanium dioxide, microgyl 400. What Zyrtec tablets 10 mg look like? White, oblong, film-coated tablet, with a bisect line and YY logo. Version number, HK052017, NCDS 04/EMC 20,160,711. Trademarks are owned by or licensed to the GSK Group of Companies. Copyright signed, 2017 GSK Group of Companies or its licensor. Click subscribe to Users Productions YouTube channel.